Kia ora, I'm Dr. Helen Fulcher, and I'm speaking with Dr. Miriam Martin, who's a general practitioner and urgent care worker. Hi, Miriam.
Hi.
Now, we're going to talk about fingertips today.
Yes, I've got lots of fingertips today.
Fantastic.
Yep.
Can you tell us more?
Well, I've worked in rural emergency departments for a long time, right in the middle of nowhere, and things come in all the time around fingers, and you're thinking, do I need to get someone up in the night, or can I just deal with this myself? So it was an area that I felt that I could make a lot of gain by getting good at it. So when I started organising my talk, there was I needed more material, so I asked people to send me photos, and the first thing was the photos were shit, and so I think I talked in my talk today about taking clinical photos and making sure that they've got, you know, focused on the right thing, a white background and you know, the name of the patient and, you know, a close-up and things, and make sure that you can zoom it out and keep it in focus, because if you can get your referrals, even texting in the middle of the night, if you're texting an orthopaedic registrar, a photo, if it's a good photo, you can get much better answers and much more help really quickly. So if people go to the Goodfellow website where my talk's going to be, there's a couple of bits of material there for them. There's a thing on peer groups, so you can run a peer group session on taking good clinical photos, and there's also an audit that people can do that's approved by the college. So that's the first thing that I did, and so then I had a case of a person who had put his hand in a lawnmower, as you do, and had done basically a different injury on each finger.
Oh my goodness.
So from, you know, just a tip of avulsed right through to almost avulsing the end phalanx. So basically we can start from the tip. If you just lose the tip of your finger, you know those ones you can't get them to stop bleeding? So my first finger tip is get some lignocaine and adrenaline and put it in a Lurin bottle and get them to stick their finger in that
so
until
just
it stops bleeding.
Fantastic.
Okay. So the next thing is a transthecal block. Most of us know how to do a ring block, so needles around there, but you can also do a transthecal block, which is better and easier, and it's got better anesthesia. So there's a video on my talk about that.
Wonderful.
The next thing, next finger tip is you don't need to wear sterile gloves. Just use ordinary gloves from the clinic, and you actually get less infection if you use normal gloves, because you can take them off and throw them away. You're not wasting lots of money. Cleaning, so don't soak your wounds, don't scrub them, don't irrigate them you don't need to irrigate with saline, just irrigate with tap water, put them under the tap, get them to wash their hands really well. The water breaks the biofilm so that the bugs fall off. And then the next thing is to use adequate pressure when you're cleaning the wound, so 8 pounds per square inch. And that's about equivalent, like I had an American article and I couldn't quite get the right equipment, but I think it's roughly about equivalent of using a 20 gauge syringe and a drawing up needle. Put a bit of plastic over top of the wound that you're irrigating, and then just squirt it as hard as you can. That's probably about 10 to 15 pounds per square inch. And if you give a good adequate clean, you're not going to need to have any antibiotics or anything after that.
It's more pressure than I think most people would use.
Absolutely.
Isn't it?
Most people are just gently fluffing it with a little bit of wet cotton wool. So just give it a good squirt. You're interrupting the biofilm. You're moving any little bits of grass and grip that's sitting in the wound. Okay.
Fantastic. Keep going. This is great.
Next finger tips, tissue adhesives versus Steri-Strips versus sutures. For wounds under 2 centimetres, no difference. So you don't need to do anything fancy. Get your Steri-Strips stuck down by using Friar's Balsam. Some people haven't heard of that, but you just paint on either side, let it dry, and then stick across. Mostly Australians don't know about that.
Is it easily available?
Yes, you can just buy it from the pharmacy. They'll get it in for you. Fantastic. If there's no tension, just Steri-Strip and glue everything. If you're gluing a wound, make sure it's stuck together like that. Push it together, no tension, and then just drip. So if it was that bit there, just drip your adhesive glue on top. And you can, I have at home just used super glue. Because it's the non-surgical grade of Histocryl or whatever. Probably party line, don't use it on patients, but if you're in an urgent situation at home, like I have with kids, just
it's not the end of the world.
So sub-Angle Hematomas, the old talk was if it was 50% or more that you should take the nail off. I think that's too much trauma to the nail. And it's basically if the cut involves the nail fold, which is just that little nail fold, that just little edge of the nail. If the wound is across there, then you should take the nail off and suture underneath. I think party's out on that one though, because I think if the wound's approximated, why wouldn't it heal up properly anyway? And in the olden days, before I did prep for this talk, I was just stitching through the nail and stitching those together, and they were doing fine. Subungual hematoma you can trephine with a 22 gauge needle. Don't need to use cautery. You can if you want. Don't use hot paper clips because they don't get hot enough. And then if you burn through the nail and you're in a hurry, you'll just go with using pressure. You'll just go straight into the nail bed and you can cause a scar.
Cause more damage. Yeah.
More damage. Yeah. So don't do that. Just use a 22 gauge needle. Talk about something else.
Yeah.
And just rest your wrist somewhere and then just grind. Just slowly wind it down until you just feel a wee give.
Yeah.
And then the blood will come out. If it's a big subungual hematoma, you can just go at the end of the nail.
And let it out,
release it. Let it out that way. Yeah, I don't know why people need to keep going through the nails.
Yeah, I think traditionally taught.
Traditionally taught, yes. So tuft fractures, I had in this person's hand, he also had a mid-phalanx fracture where he lost the tip of his finger. Yeah. So if you find the tip of the finger, you should wash it in saline, put it in some gauze with saline, put it in a lab bag, then put that lab bag in some ice. And then put that in a container to take with the patient if they're going to have that put back on somewhere. If you've got a mid-phalanx fracture, it's not unreasonable to send it to a plastic surgeon or a orthopod, and they can fix that for you. But if you're in the middle of nowhere and the situation means that you end up doing it, it's actually not that difficult. I mean, the day that I was doing this, I was thinking about referring this patient. But one of the other SMOs walked past and looked at it and said, "Oh no, you can do that." So I'll give it a go, and it actually went really, really well. So you just look at your tip. There'll be look at the X-ray. If there's any bone fragments, pull them all out. Then trim down all your sharp bits. And if you've got enough tissue to bring up over the top of the bone, then that's good. If you don't have enough tissue, you just keep nibbling it down till you've got it to the right spot, and then just scrape away at the germinal matrix underneath the end of so you don't get a little stubby fingernail coming through. And then you pull your bit of tissue up and over. I sort of put a few stitches in, and I still had a gap, but that can heal by secondary intent. And apparently this guy's finger did really, really well. Wow. So that was quite exciting.
So what's the time sensitivity with the tip if you're aiming to put the tip back on in terms of how
I would have thought 12 hours, 12 to 24 hours would be put on. So one of my big fingertips that comes out of this is you don't need to use antibiotics for distal phalanx fractures.
Yes.
Yes. If you've cleaned it well under 8 pounds per square inch, you don't need to. Just copious irrigation.
If you're not confident, what antibiotic would you use?
Fluclox.
Okay.
So if it's an at-risk wound, immunocompromised, lots of crap has been in the wound. It's maybe a bit old before they presented, then maybe you would. But I have often given just people 2 grams of Fluclox stat. And then oral to follow. And that's worked quite well as well. So, and the next fingertip is follow up. So you can leave that all covered up for 5 days before you need to open it up again, unless the patient says that it's really, really hurting or they're getting a fever. So you don't need to do daily dressings or 2 daily dressings or anything.
And when you dress it, what is your preferred dressing?
A non-adhesive dressing over the top that's healing. Like if you've got a gap of under 1 centimetre, it can heal by secondary intent. So just put a bit of paraffin gauze over that and then wrap it. And even just splint it in extension. So my father's an old GP and he just used to use a tongue depressor wrapped in gauze.
Perfect. Effective.
Perfect, and that's what I use. Or you can use a mallet splint, get a really large size one and put that over the top so that, and I just cover the top so that they're not going to bang it on anything.
Perfect.
So, I had lots of case examples which you can have a look. It's amazing the number of people who sent me stories and photos of their children and their family members who've had and you can pretty much, for children under the age of 3, just pop it back on and Steri-Strip it on and it will probably do fine.
They're amazing, aren't they? What are the usual method of injury? You mentioned a lawnmower, like car doors, things like that?
Car doors and wind blowing shutting doors. And then stick blenders and and magic bullets.
Okay, so so
there's some safety tips here on my handout as well.
Oh, fantastic, Miriam! Well, that's a great resource to have on the website. And thank you for your talk today, and thank you for the fingertips.
Okay, thank you very much.
Thank you.